All right. Hi, everyone, in person and online. Welcome to the final Research and Practice Seminar presentation of the semester. I'm Callie Lambert. I'm the Administrative Assistant for the Office of Sustainability. Our director, Brad Flam, can't be here today. He's giving a guest lecture in a Sustainable Food Systems class. That happens to be at the exact same time. But he sends his apologies for not being here, but we're very excited for today's presenter. Well, this is the last presentation if you want to know about who presented this semester. All of these presentations will be online on our YouTube and Digital Commons site. If you want to pick up one of these in person, they'll be at the front table, and online that's available at our website. So please join me in welcoming Professor Ramona.
Hi, everyone. Thank you for making the time to come in today. So I am a professor in the Department of Public Health Sciences at Westchester. I came to Westchester in 2017. Before that, I was a research professor, which basically means I was covering my salary through grants, even though I was a faculty at a different university, but my entire salary came from grants. So my teaching was optional. I taught classes, but it was optional. I will also say I finished my PhD in 2001. So it's about 16 years between 2001 and 2017 when I moved here. And I actually finished my PhD in Louisville, Kentucky. So it was interesting how I continued to work at the same university, even though it was a different department, a different college, where I completed my doctorate. My doctorate is in program evaluation. And some of the work that I did this is the abstract for today's presentation, but I'll go back to it in a second. So some of the work that I did as a sociologist trained in program evaluation was evaluating programs that had a social impact, but generally that is paired together with health. So in many ways, everything that you see on this slide, the work that I have done with the welfare recipients or the program evaluation for the welfare reform, the community collaboration for children program, as well as mortality and neglect, the work that I did with the Department of Juvenile Justice, Department of Justice in Kentucky, Department of Public Advocacy. So all of the work that I did really is focused on vulnerable populations that are one way or another influenced by the context in which they live. We call that a sociological model, but I'm going to speak. Do you have?
Sorry, I think someone wasn't muted, but
you're all good. So I'm not going to bore you with too much theory today. What I will try to do is to show you some of my experience as a sociologist with urban sustainable neighborhoods and how the physical environment, the built environment, is very much an influence on the economic development of the area and also on the social and health well-being of the population in the area. So today's presentation is focused on public housing populations. And I primarily talk about the program evaluation for urban revitalization program that was funded by Housing Urban Development in Washington, D.C. across the nation. There were close to 300 projects. I think Philadelphia had 5. Louisville, Kentucky had 5. And I started working with them in 2004, and I finished my final report during the fall semester in 2017 when I was already a faculty at Westchester University. So the abstract for today, let me just have a disclaimer here. When I was asked to do this over the summer, I had absolutely no idea how am I going to integrate the sustainability issue, the urban sustainability issue in the kind of work that I did, because my focus in this big program, you can imagine I wasn't the only one who was doing any sort of research. But my focus was on the community supportive services, on the social services people receive, and less on the built environment and less on the economic development. Nevertheless, all of those were intertwined in the decision making. So in any sort of meetings people had, they were not just discussing the progress on buildings on different streets or different phases of the construction or demolition or whatever it was at that time. But they were also about the participation in community supportive services and relocation services and so on. So let me tell you a little bit about housing as a social determinant of health. One of the reasons that because social determinants of health was always my focus, and I can tell you my first job after college was with Doctors Without Borders as a sociologist. So I did a program evaluation for a community reintegration program of a minority population in Romania. So I already had some experience with community housing, social services, educational services, and so on. So when I was asked to do the program evaluation for this specific project, the first thing that I wanted to make sure is that I understand what I need to do. Will tell you, I come from Romania, the country with the highest home ownership proportion in the world. We have 94% home ownership. I had absolutely no understanding what public housing was. The concept wasn't familiar to me. And I can tell you a personal story since I'm done. Can you come in and have a seat? My first experience with public housing in the United States was in 1998. I was dating my husband at the time. We went to a concert downtown Louisville and we got lost. There was no GPS at the time, okay? We got lost in one of these housing developments and the streets were very little. We had no clue where we were. We were both new to Louisville. And I still remember the fear I felt because I had absolutely no control over my safety. And it was a well-known area for high crime and a lot of issues. So that was my first experience. In the same summer, though, in 98, I was asked to do the program evaluation for one of these Hope 6 projects, but they had no data. They asked me to look for data online. So coming from Romania, where I did the program evaluation for Doctors Without Borders, asked to write an evaluation for a project I knew nothing about, it was very difficult. So when I was in these shoes in 2004, 6 years later, I knew that I need to do a really good job at collecting information so that I can report on the status of the program before, after, and so on. So the reason this housing project was interesting to me as a researcher in social determinants of health is because of their key objectives. So I looked at their grant proposal, the one that was used to get the funds from Housing Urban Development. And I saw what they were interested in, right? To reduce concentration of poverty, income segregation, improve living conditions for residents of severely distressed public housing. Severely distressed was assessed by those 4 criteria, whether there were deteriorated buildings, high vacancy, high levels of crimes, high concentration of poverty. So this is why this project was attractive to me, okay? Not too many people wanted to take it on, I can tell you that. Some of the Hope 6 research, so some of the commonalities, and I have to have a disclaimer here. I've put together some of these slides with some of my old presentations and old reports. So the references are all a bit of an amalgam of references from different reports. So I can tell you that this information on this slide is commonly accepted information in the Hope 6 research. So it's not necessarily one person who said this. It's pretty much, it's a common thread. So the Hope 6 research accepts the idea that the local governments, the businesses, the nonprofits, they all should engage together in social capital interventions that include community capacity building, in addition to individual skills development, increased family and individual self-sufficiency, and to accelerate the development of collective efficacy. The energy efficient public housing initiatives under the Hope 6 program were designed to address both the physical decay of distressed public housing and the growing need for sustainable, environmentally friendly housing solutions. So these initiatives are aimed generally, the Hope 6 initiatives in the United States aim to revitalize public housing communities, reduce energy consumption, lower operating costs, improve residents' quality of life by incorporating energy efficient designs and technologies. So what about Louisville? Let's talk about Louisville. First of all, HOPE stands for housing opportunities for people everywhere. And the reason we call it Hope 6 is because there were multiple iterations of this program. So this is basically the latest, the last, and the most improved Hope 6. So the sixth iteration of the Hope 6 program, of the Hope program. So it was created in 92 by the National Commission on Severely Distressed Public Housing, and was charged to develop a national action plan to eradicate severely distressed public housing. They recommended revitalization in 3 general areas: physical improvement, management improvements, and social and community services to address the residents' needs. I took this information from the grant proposal that the LMHA, meaning the Louisville Metro Housing Authority, had in early 2000s. So this was one of the grants that they received. The goal for the project in Louisville was to develop a mixed income community, and that's one of the keywords that I need to keep in mind. With heightened livability for residents, reintegrate the site into the fabric of adjoining neighborhoods to reduce the negative effects of concentration of low-income family in one tightly constrained area. So as you can see, you're going to see a little bit later in some of the maps that I have. Louisville is a highly segregated city, or it used to be even worse than it is today. And it was highly segregated by race, by income, by socioeconomic indicators. So the Louisville Metro Housing Authority focused on the improvement of the physical and property management and on providing social and community services to their residents. That social and community services program was called Community and Supportive Services, the CSS, case management program. It was meant to be, do we have any social workers in this room? No. Okay, so it was meant to be what we call a wraparound services type of program where people were met wherever they were, so that the needs that they had were addressed as best as they possibly could. So here are the HUD projects in Louisville. So as you see, 96, that was the program that I told you that as a doctoral student in 98, I was asked to work on the data analysis, and there was no data, so and the internet was not as good as it is today. So I can tell you that my summer little internship or whatever I had with them was a big flop from my point of view. The reason I have those two amounts of money is because the first amount, the 20 or 22 million, was the money that came from HUD, from Housing Urban Development. But all of this money had to be leveraged by community funds. So whether they were in cash or in kind, they were supposed to have a certain amount of money. And the reason was not as much the money, although this is the money to make better neighborhoods. But the reason was to see or to show that there is a buy-in from the community. And certainly downtown Louisville today, I still have a house there, so I can tell you that I'm going there every summer, winter break, whatever, is a vibrant city, but it wasn't like that at all. Most of these neighborhoods that you see here are located either downtown, which is kind of in the middle of the county. Louisville and Jefferson counties have the same geographic boundaries since 2000. So just so you know, if I say Louisville or Jefferson County, it's the same thing these days, metro area. But what I was going to say is, it's a vibrant city now. It used to be a very dangerous place to get lost. Okay? As I said, I was starting to be involved with in 2004. So Clarksdale had 2 grants. Phase 1 and phase 2. It has been renamed. The new neighborhood is called Liberty Green. The Sheppard Square has been it retained its name because it's a historical name. It was established sometimes in late 1800s, and it was established by an African-American missionary who wanted to have an area for African-Americans to as a community. Again, this was 1800s, late 1800s, 1874, I think. Now, Hope 6 today doesn't exist anymore. HUD changed because of the results of the Hope 6 programs across the nation. They decided that they don't want to basically demolish entire neighborhoods, build them and replace them with housing that I'll show you in a bit how those look like. They wanted to shift towards providing people with housing choice vouchers because the people who have used that option in the past, the ones from Hope 6, they were better off than the ones that moved to just another public housing development or senior living if they're older. So the Beecher Terrace or Russell neighborhood, how it's called, it's a little bit closer to the west, so farther west. And they started in 2015 with about $500,000 for a planning grant. They got $1 million then in June 2016. And then 6 months later, they actually got close to $30 million to rebuild that entire neighborhood. It's like a 10 block. It's a huge area. Now, I will have to say, a little bit of pride there, as I consider Louisville my second home, really. Louisville is the only city to receive the 3 HUD's Choice neighborhood grants. And I can tell you that's not by mistake. It's not by accident. As a professor, as a research professor and working in Hope 6 for many, many years, I went to annual conferences, to Urban Affairs Association. I've listened to other people's experiences with their Hope 6 evaluation. And I had none of the problems that those people had. In other words, I haven't seen the corruption that I have seen in other cities. I haven't seen how other people were treated. They were given $500, not in Louisville. They were given in other places, they were given $500 and that was it. Okay, so that was one of the reasons, situations like that was one of the reasons that HUD in Washington, D.C. said you need an external evaluator. So I don't know how many of you are familiar with logic models. Let's see a show of hands. No? Okay, kind of. So this, I called it operational model. And the reason is because there's a big picture. It doesn't really give you all of the little details of everything that has been done with the Hope 6 program in Louisville. But I wanted to bring this to give it to you or to show it to you so that you kind of have an idea of what kind of goals they had in Louisville, what kind of approaches they used, and what was the impact they were shooting for, what they were trying to achieve. And the impact, as you can see, is community level and some at the individual level. And those arrows there are intentional because those are influencing each other, right? So they're in the same context. But as you can see at the community level, what did they want? They wanted mixed income communities, and I'll explain why. They want improved public health, economic growth, basically economic investments, decreased service needs. They did have an opportunity zone in that area, so they wanted to bring in investments and incentivize local businesses to be there. So they were hoping to lower crime, poverty, unemployment, just by simply giving a facelift to that entire neighborhood. Let me see, in terms of network, as you can see, this was not just one agency that was involved in rebuilding that community. Again, this is another reason why Louisville Metro Housing has been funded pretty much every time there was only one that we didn't get funded in 2009, but we got funded in 2010. The reason that is because they have really engaged the entire community in this process. Louisville, it's a small town, even though it has, about 1 million people, 2 million now, I don't know. So it's from my point of view, it's still a small town, so it has that feeling. So people know each other, right? So, and there is a little bit more networking even, I can tell you that. That's one of the perks of being a smaller place than Philly, let me put it that way. But you can tell that there are lots of UK U of L, so those are the University of Louisville and the University of Kentucky. KCTCS is our system of community colleges and technical schools. We had all sorts of employment nonprofits, Urban League, it's the same that you have in Philly. The 7 counties is a program or an agency that provides support to people with mental health and substance abuse, and so on. So one other thing I will say, Louisville is known for their parks and is known for restaurants. So if you ever go to Louisville, that's what you will notice, parks everywhere and lots of good food to eat, super diverse food from all sorts of corners of the world, okay? So one other thing I will say is that neighborhood places. Neighborhood places is a concept that started in Louisville. It's basically, they're buildings that are located in areas where the social services educational needs are. So what these neighborhood places were, each department, health, education, social services, every department in the government had a location at that specific in the neighborhood. So the reason was because people didn't have the transportation options that they needed. So they needed to access the services. So therefore they took the services to them rather than having people going somewhere downtown and try to stay in line in one building. Are you with me on that? Or in multiple buildings. So this was located there. This is the what I call logic model rather than an operational model. And this was particularly for the community supportive services. That was my responsibility. Some of the activities that were relevant to what I was doing for the community services are also very much indicative of their efforts to develop that sustainable neighborhoods. So the neighborhood places that I was just telling you about, that was another effort to provide a infrastructure for the social services. So people didn't have to rely on temporary, if you wish, locations. That those were built, were old buildings that were rehabbed and turned into these neighborhood places. But the types of activities you can see here at the top of the priorities was the employment, career resources, education. These communities had a high proportion, more than half of them didn't have high school or GED. And they have no work experience. So it's very difficult to find a job if you have absolutely no work experience, okay? Especially if you also have a couple of small children and you have no access to daycare. So at any rate, so yeah, I did some services and you can look at the outcomes in terms of thriving community. We were interested in walkable neighborhoods, mixed income communities where people could develop networks with folks from all walks of life. But in the same time, they wanted enhanced property values. They wanted neighborhoods with racial diversity, improved safety, right? Playgrounds for children, reduced housing costs, community engagement, economic investments, and so on. In terms of the presentation today, if you look at the very bottom, the lower utility cost is very important, because if you have housing that it's energy efficient, then that helps you save some money. And instead of using the money for paying hundreds of dollars in utility costs, you can use that money for food, right, and other services for your children. And of course, because I'm a public health person, I was always interested in how will that improve public health? What would be the indicators? What is it that I could look for to see if there was an impact in public health? From my point of view, a safe neighborhood is a healthy neighborhood. A neighborhood with green space is a healthy neighborhood, right? What do we need to do if we have mental health problems? Just get out and walk for 5 minutes, right? But if you are in a neighborhood that's not safe, can you do that? I don't think so. Can't even drive safely sometimes from some neighborhoods. If you are not familiar with the area, or you feel like you might be considered a threat to the community by showing up in an area. So why did we need Hope 6? So I'm going to break this down in those 3 section. So the boarded windows, uninsulated walls, exposure to asbestos and lead, soil erosion, broken sidewalks, flooded basement. As you will see in some of my maps, Ohio River is very close. So we Louisville downtown in that area has a tendency to flood. So over not hundreds of years, but some of them were more than 100 years, but one of them was developed in 1930s. So tens of years, let me put it that way, so I don't exaggerate. It does tend to put a toll on a structure, on a neighborhood. Graffiti, trash in the streets, rodent, cockroach infestation. I mean, there are all sorts of issues. The building design. So you will see this in a lot of Hope 6 research. They are talking about how the building design of some of this old public housing environments was actually conducive to crime. There were all sorts of little corners and hidden spaces. So the actual architecture of the place has changed a lot for that specific reason. The socioeconomic environment. Mostly these neighborhoods are made up of women and children, low income, less than high school education. Yet those neighborhoods were, again, high crime, high poverty, racially segregated. And the people who lived there were not the crime, but were not the people who were perpetrators. They were the victims because those neighborhoods were seen as vulnerable, therefore they were used for all sorts of activities. And of course, there was a high prevalence of chronic disease. I can tell you, I've seen a lot of physical disability, mental health issues, substance use, some, not as much as in other. Now, with regards to the physical environment, I can tell you the little I knew about it. There was the new urbanism theory that was the underlying belief or underlying how can I put this, model, if you wish, for redeveloping these neighborhoods. It emphasizes walkability, safety, community, private homes with green space. For public housing, they're looking to more private homes so that you can't really tell the socioeconomic status of that family. And the duplexes, row houses, it's very common for that. Here's an example of my first experience with Clarksdale. So that was the neighborhood my husband and I got lost in '98. There were about 695 households, 1,500 residents, and of those, they lived in 713 dwellings. The reason there are more households than there are more dwellings than households is because some of those were vacant. The demolition started in September 2004. As you can see, there were about six city blocks. The occupancy started, reoccupancy, basically getting back some of the people who wanted to, was in March 2006. They completed it by 2009. So that's the house that you saw in the same location. You can see this picture was taken from brokensidewalk.com. It's an old picture. I didn't have the presence of mind to take pictures when I was working on this project. At any rate, so that's exactly the same spot. So that house was replaced with the house that you see. You can notice that there's more green space. There's landscaping with native plants that are allowing for low maintenance. And it's a duplex, right? So it's almost like a townhouse of sorts. Those 713 were replaced with 453 units on that specific blueprint. And they also added 402 off-site units. So what I liked about the LMHA, and I want to acknowledge the former director, Tim Berry, and the former director of social services or special programs, Diane Foster, they both retired recently. They were super creative of how to use every penny. And they bought land across the county to build more units. So they didn't just remodel and beautified and revitalize the downtown area, but they have done that in other places in town where there were vacant properties. So they increased the property values across the county. The Liberty Green amenities, this is an urban sustainability presentation. I wanted to bring this, the street improvements, parks, commercial development, those landscaping requiring minimal maintenance that I was talking about. They have pervious pavers in some areas to limit the runoff of the rainwater. And they have central air ceiling fans. Of course, that was not an issue. That was not present in the previous buildings. 9 feet ceilings. Louisville is a pretty hot and humid area in the summer and very cold in the winter. So the wall-to-wall carpeting is pretty general because it's warmer. They had dishwashers, garbage disposal, washer dryer hookups. Those were not, that's definitely not something common in the previous buildings. And the wiring is internal, but also even the electrical utilities is underground rather than being overhead. All buildings and units were at least 30% more efficient than required by the building codes. They had high levels of insulation, high efficiency heating and cooling, energy efficient windows, enhanced ductwork. So it was basically insulated ductwork so that they don't lose too much energy. So I can tell you from my interviews with people that over time with the hundreds of people that I talked to, they were surprised about how much less money they had in their utility bills. So this is the Liberty Green. This is how it looks pretty much these days. It's really close to the medical school, and I worked with them, so I walked those streets quite a bit. These are some other examples of pictures I found online. Those are the row houses, townhomes. This is the second Hope 6 project that really, I thought that this is the only one that I'm going to talk about today, but they're so connected together that I felt like it's probably a good idea to give you a run. I know more about Sheppard Square because this was my second experience, so I did a better job the second time around. It was a smaller neighborhood. You probably notice of those two pictures, the main thing that stands out is police do not cross. There were lots of crime. There was a lot of crime. And I can, if we have time, I'll show you some of the comments that I collected from folks. So that was the previous park that looks much nicer these days. The Presbyterian Community Center was a big building there, and that's the one that the missionary that I told you about, that was built in the late 1800s, early 1900. So they donated it. It was rehabbed and it was used for senior living, so for senior care type of units. The other thing that I will point out here is the Family Scholar Program. Louisville is, Kentucky in general, I think, is a source of new ideas. It's amazing to me how many innovative programs from that area have become national models. And at the time I was working with this project, I had no clue that I was in the middle of a lot of innovation. The Family Scholar House is for single moms who want to go to college. So they started with a location nearby the University of Louisville, and then they developed more across Jefferson County. And this is the downtown Family Scholar House. So they are all working together. I will say there was one advocacy group that was an ad hoc group where people from a variety of agencies came to Louisville Urban League, and they were sharing stories and asking for help so that they can help their clients, their patients, whatever, depending on the agency. But they were trying to get services for folks from the community and try to remove as much of the duplication of services as they could. One of the places, so I was the only one from the University of Louisville who was going to those meetings. There were quarterly meetings, and I only found out about it because I was involved with the Hope 6. But I was very impressed with the fact that people take time of their personal time and come to these meetings and try to find ways to solve community problems. The Section 3 program, I don't know how many of you are familiar with it. It's basically a federal program that is providing, so it's like a grant that provides training, employment, contracting opportunities to lower income individuals. So the neat part about it is that Louisville Metro Housing actually hired people from the neighborhood to work on this redevelopment and revitalization. So here's how Sheppard Square looks like today. All of these pictures are from online. I'll tell you that because, again, I'm not a picture person. The socioeconomic environment was the second bullet in the need for the public health. So one of the things that I noticed that, again, the common thread, I think it started with Alexandra Curley, who is a Hope 6 evaluator in Boston. If I recall correctly, she contacted me when she was still a PhD student. So she published a lot of articles on social capital theory in Hope 6. So that was very fast or very quickly adopted. But I will say the whole idea of the social capital theory is that if you live in a neighborhood that's a mixed income neighborhood, your kids play with kids from other mixed income families, and if these families' children finish high school, then it's likely that the kids who might come from families who do not have a high school education, those kids will complete high school as well. So that's just, in a very simple form, a way of influencing each other, let's say, in a good way. Now, certainly there's lots of criticisms to that idea, because when people lived in these public housing developments, they supposedly developed some networks, and they lose those networks when they are completely relocated to other places across the county. This is Jefferson County, Louisville. So in the center, you can see that's where the Sheppard Square was. So in 2012, when this entire program started the funding was in 2010, and they started demolishing and rebuilding in that area. I used the census in 2010 data for this, so that to kind of give you an idea. The blue shows the areas with the least proportion of Black African American, and then the red shows where they're concentrated. So this is an example of a picture that shows you how segregated the Louisville this was in 2010. This is poverty. Does that look familiar? The least poverty is in the East Louisville. The most poverty is in the West. So again, the people in public housing and most of those red areas in downtown, that's where the downtown is in that little horn, if you want to look at it that way. And at the north boundary of that county is Ohio River. On the other side is Indiana state. Okay, so here's another example, crimes. So you can see that the most crimes are located in downtown or west. One thing that I didn't notice, you see this map that has that shaded area. That's because that's where the airport is. So there are no people living there. So that's why that is on this map, for whatever reason. It does have drugs and related crimes because crime does happen in airport areas. Assaults, there you go. So by now you can see the pattern. I will provide a copy of this presentation to sex crimes. Again, blue is less and less prevalence, and then Sheppard Square evaluation. So I can tell you that I was involved with them in 2009, 2010 doing a needs assessment. And the needs assessment generally are surveys that you're collecting information from folks for the purpose of the grant proposal. So in 2009, I think, and 2010, sorry, we didn't get funded by HUD, and then the next year we resubmitted it. I spoke with about 210 folks or households, because I collected information for everybody from the household. But one thing that I want to point out, because these numbers are not as important as it is the pattern. So if you notice that there are out of 814 residents, 506 are children. 276 of them were below 5 or less years old. So there were a lot of school children, and many of these children were bused around county and taking maybe an hour in the morning, an hour, maybe more, depending on traffic, later on to transport these kids to different public schools across the county. So one idea was if we move these children in neighborhoods that are with better schools, then we solve the problem with the transportation as well. Majority were females, majority were single, widowed, or divorced. One little difference between Sheppard and Clarksdale is that this neighborhood had Somali refugees as well. So when I did the evaluation, obviously I needed a translator because I don't speak that. So this is just a graph to show you who was in my evaluation. I did allow people and everybody to participate. I did not sample, so it was a population study. And overall, I talked to 237 households, but 184 of those I had data at both points in time. So again, majority were females and young with children. The income was below 40,000 in at the follow-up, but it was 100% below 40,000 at the time of relocation. So there were some improvements. If you can see there, 67.8% had household income. I think I meant greater than 10,000 compared to 56.3 at baseline. I'm gonna have to fix this before I send it back to you. So there were some income changes. 37.7% increased their income. 43.5 had the same income when they left. Remember, there were a lot of people with physical disabilities who were not able to work for that reason. And 18.8 said they have lower income. There was changes in household expenses. 5.7 of them only had fewer, majority had higher household expenses, and that's primarily because they chose to relocate to areas where they used Section 8 vouchers, so the housing vouchers, and that means market rate rent. And they were supposed to, they had a certain number of years to find a job and become self-sufficient, and if they didn't, they ended up having a reduced rent covered by the government, so therefore they have less money left in the pocket. Hope that makes sense. The median household income in Louisville, you can see that even from an income point of view, Louisville is fairly segregated. In terms of employment, the greatest increase in the employment was among the African Americans in Sheppard Square. The Somali population already had a pretty high employment rate, so it didn't change much to the follow-up. All I can say is 35% were at the current job for less than a year when I talked to them. 35% were about 1 to 3 years, so they maintained the job. That was a good one. And then another third of them, about a third, were at the job for 4 or more years. So these were really good outcomes because these were people who didn't have employment at all. Just remember that. The unemployment rates, needless to say, it's a huge difference between East and West Louisville. What barriers to employment people had was primarily access. They didn't have cars. They didn't have access to many times to a good transportation, because not Louisville's transportation, or at least at that time, the network of buses and whatever, it wasn't as good as if you had your own car and made your way there. So if you don't have a car, the opportunities for employment are reduced, right? But and this was one of the criticisms of Hope 6 is that if we move people from downtown, they don't have access to transportation, and that didn't end up to be the problem at all. Another criticism was if you move people, then they don't have access to health services, and that was not the problem again. So people chose where to move, to relocate, so they had options, so they knew what they were doing, right, when they were relocated. This was the percent with less than high school education. So again, you can see that it was pretty low in the western part of the state. In the interest of time, I'm not going to bore you with a number of families with kids and without kids for the evaluation purposes, but I will say the 3 relocation options that the people had after they demolished everything, they were asked, where do you want to move? What kind of option do you want? A scattered site public housing means it's a home that is owned by the housing authority, because as I said, they were making every penny count. So they were buying properties and rehabbing them or rebuilding houses. The Section 8 voucher, that's the one that the new initiative, the Choice Neighborhood, is using. And there were other public housing developments, but I will say some people chose to move without any support at all. They decided where to go and they didn't want any help. So this population is highly mobile. So one of the issue was, well, if we're moving them here, where are they going to be in 5 years? Are they actually going to really integrate in the community? Those whole social capital theory might not work after all. Well, 59.2% of them resided at the same place at follow-up as they did when they were relocated. So it was pretty good. But what I found interesting is, again, another criticism of Hope 6 was that the new mixed income community is unattainable for the former residents, and we do want them to have the option to relocate here, and we make it too expensive for them to come back. Well, that didn't end up to be the case. People didn't want to move back. Once they had a single family home with a backyard, good schools, good neighbors, safe in the neighborhood, they didn't want to move back. Because their memories of the neighborhood was not of the new neighborhood, was the old neighborhood. So they didn't feel any more connection with it. So in fact, 49% said that they would like to own their home within 5 years. So that the home ownership desire increased, as opposed to only 39.5. But and only about a third wanted to return versus pretty much half of them wanted to return early. The majority of respondents liked the landlord, the building management, the maintenance, the upkeep in Sheppard Square, because they didn't have to do it, but there were bad buildings. But they don't necessarily consider, so they don't like the management as much, the people that are managing whatever new building they were in. But they liked their new homes in the new neighborhoods because they felt safer. This is just an example of where they were at the baseline and where they were at the follow-up. So to answer to the criticism about the service provider location, I showed that actually there are service providers everywhere thanks to the way that Louisville is networked with those neighborhood places. So that was not an issue at all. I will say that the majority of respondents felt integrated in their new communities and shared similar values with their neighbors. Go ahead.
So they integrating to the east.
Yes, so there were, if you look at the relocation, to the left, it's where people moved, and those are the number of households in the color. So the darker color shows higher, red color shows more people moved in those areas. Because many of these people were older, they had to stay in areas where they had senior care living public housing type. Yeah, I mean, you can see that many of people moved, they chose to move to the east. How many of you are familiar with the NIMBY? Not in my backyard. Have you heard that concept? So there were a lot of, I was even called Dr. Stonewall because my report showed that the program has positive impacts on the community, right? Socially, even from a health point of view. I don't think I have time to show you that, but I will. I was attacked by a local so-called advocacy group that were actually advocating for African Americans to stay where they are. In other words, don't come in our neighborhoods. That makes sense. So it was, I think that the name of the newspaper was Leo. So they were trying to diminish everything that I had in the report. This was for the Clarksdale report because they didn't want the Sheppard Square to happen. That makes sense. Sheppard Square is called also Smoke Town because we used to be an industrial area. And it's close to Phoenix Hill, which is super rich. So there was buy-in to the community from that area, but then most eastern part of Louisville didn't want this integration, I guess. I don't know. No, this is a small town. In terms of key factors of the relocation, you can see that the higher, in other words, blue and green were put positive changes in general health, quality of life, access to public transportation. Remember, that was an issue. Access to jobs, household expenses. So higher household expenses were higher, as you can see there, but in the same time, they liked where they were. The income was better too, for close to 80%, as you can see. So the blue and green together is good. The red is bad. All right. So this was a study that I did. I wanted to see what it is that makes a difference, why some people feel safer in the neighborhoods and not in others. Generally, from my studies, what I can tell you, I found out that people who moved to other public housing developments, large public housing developments, they didn't feel as safe as those who moved in neighborhoods with single homes or duplexes or smaller neighborhoods, basically. The scatter housing, the scatter sites, that's how they refer to it. Those are the people who felt the safest because they connected to their community. They registered to vote in that area. The kids went to better schools. And one of the indicators when we look at neighborhood safety is how safe do you feel in your home at night? And I can tell you that only about 15% in Sheppard Square, as you can see here, about 15% felt safe in their own home at night. Just imagine the stress that you would have if you don't feel safe in your home. People were shot through the walls. People were just by drive-by shooting. So there was a lot of crime. And how do they feel? How safe do they feel outside at night, right? So if you have to take the trash out to the curb, do you feel safe to do that after dark? So in Sheppard Square, there was a problem. 45% felt safe outside at night, 15.4% felt safe inside. Sorry, it's the other way around because I'm looking at the clock and I see that I'm late. 45% felt very safe outside in the new neighborhood, 15.4% felt safe outside in Sheppard. But with regards to the neighborhood safety, 70% felt safe in the new neighborhood overall, 60.4% in Sheppard. So generally 12.4% felt that they live in areas that are less safe. Majority lived in safer neighborhoods. So these are just the measures of safety. So there are some scales that measure neighborhood safety. And these are the items, the 9 items that I found important when I did reliability and validity analysis. And you can see in red at the follow-up, very few, the way fewer residents who felt that those issues are still relevant in the new neighborhoods as compared to the previous neighborhood. And finally, in public health, I can tell you that depression was a big issue. And this was a regression model that I did a while ago. And I found that residents with poor health, they were more likely to physical health, they were more likely to have poor mental health. Residents who were worried about their children's health were more likely to have health issues themselves. Social support seemed to be less important than neighborhood safety. So their breakdown of the networks that they developed in the previous public housing development, it wasn't as important to them as the neighborhood safety was. This was an example of a project that I did with the Clarksdale and Sheppard Square residents who are 45 to 75 who are eligible for colonoscopy for colorectal cancer screening. So the reason I wanted to show you this is because these areas are, or this population, a public housing population, is a fertile ground if you do health research, public health research, because there's very little research done with these populations. And because you see, if you work with them on a project, and if you gain entrance in the community, they trust you. They know that you're not going to survey them to death and then forget about them. You always get back into the community and provide the results of your studies. So this is just a lot of the number of people that were eligible for that study, and I ended up with 200 that were invited to participate, but they wanted their family members to do the fit kit as well. So I ended up having 209 people who completed the survey, the baseline or the initial survey for that study, and also non-family members. 149 returned it. That's a huge return rate. I can tell you that because I'm doing the same type of research here, even though it's not public housing. And I only get response rate, it's about 25 to 30%. And then 60 didn't return it. So I'm going to go ahead and end with this because I will say out of the 42 who were positively screened or had a positive, I should say reactive fit screen, 36 of them were re-interviewed, 22 already have a colonoscopies, 5 are pending, and some refused to answer. But I will say that they were pretty receptive to the possibility of to participate in public health research. So this is where they were located. You can see it's just random across the county. And most of my references that I told you I collected from, I cannot believe I went through this entire thing. Now I do have extra slides I took out, but. So thank you so much for your attention. I know I have been gone more than I was supposed to, more than 50 minutes. But I appreciate your patience. Hopefully I said something interesting that you will take with you, and happy holidays ahead, and good luck with your finals. Okay.
Yeah, thank you so much.
Question. So
Yes.
when the families that were moving out of the west going to the east,
So everybody on
were
Zoom,
the
we
houses
had
that were in the west that were
a class that popped in.
They brought in mixing.
So I don't know if
Yes.
we'll have time
So
to do
they,
questions, but if you want to stick around,
What I will
we might
say
be able to
is
do a
if you look
couple.
at the
Thank you.
original one, I'll show you what the